The following portion of Daytime is sponsored by Orthopedic Medical Group of Tampa Bay.
If you fall and twist your ankle, there's a good chance that there's going to be pain, swelling, and bruising, of course, will follow too. A sprained ankle may require even medical attention, especially when it's severe. Here to discuss treatment plans is Dr. Adam Jester with the Orthopedic Medical Group of Tampa Bay. So nice to have you here with us.
Nice to meet you, Farron. Thanks for having us.
So talk to me about this. What are the common causes when people come in and they have an ankle sprain? What happens?
Sure. I think it's easier to show the model and go over kind of the anatomy and the most common mechanism of injury for an ankle sprain. The ankle mortise is typically made up of this bone, the shin bone, which is the tibia, the lateral malleolus, which is also called the fibula, and then the foot, which is the talus here. The most common story that we'll hear in the orthopedic office, and this is certainly one of the most common injuries that we treat in orthopedic surgery, is the patient rolled their ankle. But otherwise, it's an inversion injury where the ankle kind of stresses like this. Now, as you can imagine, that actually puts stress and tears the ligaments on the outside. So the most common injury for an ankle sprain is a rolled ankle, where the ankle does this, and you injure the ligaments on the outside or the lateral part of the ankle. And that's certainly the most common mechanism of injury. Now, as the ankle rotates differently, sometimes you can injure other injuries, other ligament complexes. There's a ligament complex that also runs up here called the syndesmosis, and that's also called a high ankle sprain. So that can also be an ankle sprain, and then on the inside, you have what's called the deltoid ligament, and then you can sprain that as well.
Wow. Okay, so I'm trying to gauge, how would someone know how severe their injury is when it happens? I mean, obviously it's, ouch, it hurts, or you may lose balance or something like that. But when do they know this is a time to seek medical attention immediately?
Sure. So there's different grades of ankle sprains. A grade 1 would be a minor ankle sprain where there's only partial tearing or straining of the ligaments, up to a grade 3 where you have a complete tear of the ligaments. With the increase in the grade of the sprain, you'll often see more swelling, pain, and bruising. So certainly moderate swelling, pain, ecchymosis, or bruising would be certainly a good reason to come in and be evaluated.
So what are the treatment options for that? Let's say someone's only at a 1 or a 2. What are the conservative treatment options?
Sure. So even before we see you in the office, you can't go wrong by starting with the traditional treatments of icing it, elevating it, compression with maybe an ACE wrap or something to compress it, and then also an over-the-counter anti-inflammatory.
Okay.
The next step would certainly be to come in to our office and to see us so we can do really 2 things. One, evaluate with x-rays. Not every sprain is a sprain. Sometimes you can actually have a fracture. So that would certainly change the treatment. In addition, we can examine you at that time to make sure that this is what we think it is, that we confirm that it's just a sprain. Once that happens, then we would also kind of continue with those initial conservative treatment plans. Often put you in a boot to kind of offload the ankle and allow for soft tissue rest.
But based on those x-rays, you'll also know if it's time to have surgery.
Absolutely. So that's an important part of it, because certainly the patient or myself can't always determine based on just physical exam alone if the ankle's broken or not.
All right, Dr. Adam Jester, I can tell that you are the expert in this. So thank you so much for your advice. Yeah, hopefully, it's one of those situations no one ever wants to be in, but it's good to have the proper help when that does happen.
I appreciate it.
All right, thank you so much. And to learn more about Orthopedic Medical Group of Tampa Bay, you can visit omgtb.com. Daytime will be right back.
The preceding portion of Daytime was sponsored by Orthopedic Medical Group of Tampa Bay.